Hello everybody, this is the MPR update in our school online. Today we were talking regarding orthopedics, MPR orthopedics. We're talking today regarding the most important thing during the growth, MPR orthopedics, and that's very important, very important to understand. When we're talking regarding MPR orthopedics, we're talking regarding function, we're talking regarding growth, we're talking regarding the most important thing in our life, that when we are creating our body. Today we're talking regarding the function against the mechanic, but it's not against. It's each one is a clinical approach that we said each one in their age. What they mean during the growth is function and orthopedics. After the growth is function and mechanics, not just mechanics, function and mechanics. And to start to do something, we have to do our classification in our school. Our classification said divide in orthopedics, in functional orthopedics, and in myofunctional postural orthopedics. What is orthopedics? It is the science who perform a pure orthopedic movement. It is working in the basal and dental-alveolar bone, does not correct the function. This device does not correct the function. Functional orthopedics also work with the pure orthopedic movement, works in the basal bone and in the dental-alveolar bone, but correct the function. And the most important is the myofunctional postural orthopedic, but it is working, performing an orthopedic movement, pure orthopedic movement, working the basis and in dental-alveolar bone, correct the function, but also re-educate the muscles. Use that forces re-educated to activate the device and correct the muscle change of the body. That means it's working in posture and is releasing free the craniosacral sutures. That means it's not creating any trauma in the posture of the subject. The myofunctional and postural regulator is a device that I invented 32 years ago. I am working with this device for 32 years all around the world. But before I start to talk about the device, we talk what is the oral functional area, oral functional corridor. These muscles that when are not working well, they are creating the problem inside the mouth. The muscle activity, like hyperfunction and hypofunction, they both are generating alteration in the growth, both of them. The buccinator, the mental lips, the tongue, and the breathing, if all these things are in balance, then it is health in the craniofacial system. There is no malposition of the teeth and good growth. The hyperactivity, the bad habits, the hypoactivity or the bad breathing is generating dysfunction and bad alignment of the teeth. Balanced the muscle function, the teeth well aligned themselves. That means that malposition of the teeth is a symptom. It is not a disease. It's a symptom of this big dysfunction. Look at that. Lips hypertone. Look at that. Hyperincisor protrusion, because lips are not a good function. Buccinator and lips hypertone. Look at that. Transversal and vertical and sagittal problem. Look at this. Superior lips hypertone, menton hypertone is creating sagittal vertical growth problem. Tongue dysfunction is creating open mouth. Bad habits creating problems in the teeth. Menton hypertone, vertical growth problem. Look at that. All these patients have dysfunction of the oral corridor. Menton dysfunction, vertical sagittal problem. And look at the evolution. How this child is growing well, changing the face, changing your teeth. Breathing dysfunction, transversal problem, and a real open bite. And look at the evolution. How is closing the open mouth just correcting the function? And look at how it's changing the face, just correcting the dysfunction. This was an ocular and neuromuscular dysfunction. Look at this. And look at how the evolution, how it's changing slowly, slowly. No orthodontic treatment, just correcting the function. Acting physiologically into the body, not against the body, helping the body. The myofunctional and postural regulator do that and have different effects. Myofunctional effect, tridimensional effect, and postural effect. When we call it the myofunctional effect, why? Because it has an omega who do a good position of the tongue. It has the Frankel shields that correct the buccinators and stimulate the growth. It has a lip bumper which is correcting the lips dysfunction, and is a special internal form for the tongue which is correcting the tongue position and is helping the tongue to stimulate the growth. The tridimensional effect, because with it activation is working in the three sense of space: vertical, transversal, and sagittal. The postural effect, because cancelling the occlusion momentarily during the growth, we call that deprogramming the jaw, and centering the mandible, centering the jaw in the central relationship is correcting and helping also the muscle change. The myofunctional and postural regulator is a device which the child uses only during the nighttime, and with muscle exercises, some osteopathy treatment, some physiotherapy treatment, some medical treatment for alimentation for the internal part of the body is doing a lot of success. But they need diagnosis and projection. And the dentists have to be trained for that. Training in orthopedics concept, and then for diagnosis and to project. We do the projection, the individually projection. Each device is for each patient. We don't have 1, 2, 3, 4 type. No, the diagnosis for each patient, for this patient, this particular patient, and the technician who is formatted for us to do the device, transport the projection with wax in the models, and is creating the body acrylic that is working. We call that the pre-activation of the device that is working normally for 4-6 months. And then we do the reactivation. We have omegas, different type of omegas, 3 type of omegas. Each one of them has a different activation for each part of the device. the lip bumpers, the body acrylic, all this, as you see that each part of the device, it has an action in a particular dysfunction and in a particular patient. That is the goal of this device. And the device works in 3 dimensions: vertical, transversal, and sagittal. That's very important. One device working, stimulating, and guiding the growth in 3 dimensions. Correct the local neuromuscular dysfunction. Use that forces to activate the device and correct the postural activation, and it's only 9-time use, and it's only one device. The patient during the growth. As you see in this video, as you see how the device is working, the regulator is a device who is free movement in the mouth that stimulate the growth without make interference in the cranio facial sutures. And as you see there, you can activate anytime the doctors activate the device, doing modification, depend the problem in this particular moment. And the device is free in the mass. You see, you can activate the curve of speed, you can activate the plane, you can modify the shears, any part of the device is activated. Also the omega, the lip bumpers, etc., etc., etc. Each part is activated, is creating a new effect during the growth. And this device follows the patient for long time. And it's very important, only 9-time use, very important. And obviously, the doctors need a special training, the technician need a special training, and it's a training who allow the doctors to be ready to do the diagnosis, global diagnosis and local diagnosis, to do the projection and to act with the reactivation. And that is very important, that a device, just only one device who is working during the growth age. And after that, if we need, we use a very real soft orthodontics and very functional orthodontics, very soft and very functional orthodontics. NPR orthopedics objective is obtained an harmonic growth between craniofacial system and postural tonic system. That is the main objective. Creating a good mandibular position, jaw position, in balance with the muscle chains. NPR orthopedics, at the end of the growth, the objective is to get a good neuromuscular and postural vertical dimension of the jaw. That's very important. Just not only centrating the jaw, just create a good neuromuscular and postural vertical dimension. That is good objective. At the end of this all, we created obviously a good occlusion, functional occlusion, that will keep forever the situation in balance. And I say forever because we have balance, local balance, postural balance, and the occlusion just only keep that balance, not creating problem. To do it, we have to respect one important thing. The biological times. Do not rush. Orthodontic is not to use during the growth age. We don't have limit of time to move the teeth. we have a limit of time for the growth. We have to respect these times. For NPR, stability, it is not the first class of angle. That is very limited. We cannot think today that the third class molar do stability. No, it's a functional occlusion in a good jaw position with the rest of the body and with the muscles of the mouth without problem. This is the balance, not the first class molar. For that reason, it is necessary the intervention of all health sciences disciplines. NPR orthopedic is the evolution of orthopedics. It's putting the rest of the body working with the craniofacial orthopedics, making balance together, working with a real interdisciplinary protocol, not just with one device. To obtain all this, only one way. All health sciences speak the same language and work harmonically with the same protocol. The message of this video is that the only way to create health in the body is work all medical sciences with the same mentality, with the same all medical doctors, dental doctors, physiotherapists, osteopaths, all of them working together with one common protocol, to help our patient. We cannot do all alone. And also, we cannot do all if we do not speak the same language in diagnosis and treatment. When we have that, this is the key. This is the only key. I hope this video helped a lot of you for the future. I hope that. And we see you obviously in the next communication. We see you in the next communication. We will be together in online. And please follow us in our Facebook page. We have a Facebook page, and you will see all the news of our school, and also in our channel. Follow us in this two social networks, and you will be updated with us. And now I have to say, obviously, bye-bye. I hope you enjoyed the video, and please follow us in social networks. They are free. Follow us and you will have all the news. Bye-bye, everybody.